Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. You can really help the show reach more loss and infertility families by just taking a moment to leave a positive review or rating on Apple or Spotify. Also, check us out on Patreon for exclusive bonus content. Just go to patreon.com/Finding Hope After Loss. You can also check out more information about the episode in the show notes at journeyforjasmine.com. Today, I am talking with Laura. She is a registered nurse and fertility expert who blends clinical knowledge with deeply personal experience. After being diagnosed with PCOS while working as a fertility nurse, Laura endured years of fertility treatments, including multiple IUIs, IVF cycles, and went through pregnancy loss. Her journey to motherhood included 3 surgeries, failed transfers, and plenty of emotional setbacks, yet ultimately led to the births of her 2 sons through IVF. Now, the founder of Navigating Fertility with Laura, she advocates for compassionate fertility support. In this episode, she talks about the often overlooked aspects of infertility, the emotional toll of treatment, the mental health gap in fertility care, limited access to reproductive medicine, and the desperate need for clear, empathetic patient education. Hello, everyone. Today I am here with Laura. Laura, can you tell us a little about yourself?
Sure. So my name is Laura Wepler. I am a fertility nurse, but also fertility warrior. So I've been through my own journey with infertility and pregnancy loss. A little bit about my story. So I started working as a fertility nurse about 12 years ago. It was back in 2014. I can't do math today. So back in 2014, and at the time that I started working as a fertility nurse, I kind of started to put pieces together that maybe I had some fertility issues as well. It turns out ultimately that I did have PCOS. So I started through, kind of early journey fertility treatments with IUIs. I did 2 IUIs that were unsuccessful, and then my 3rd IUI was successful. I went through, the early monitoring at my fertility clinic and was discharged from my clinic at I think it was like the 8-week mark. Met with my OB a week later and found out that I had a missed miscarriage. The baby had stopped developing around 7 weeks. So, of course, was completely devastated and besides myself. I was really young, so I didn't really understand like why I was having a miscarriage. And I had a DNC. A few weeks went by and I thought, okay, I should be getting a period. And so I asked my doctor again, I was working in the clinic. I'm like, I don't feel any different. She was like, let's check an HCG level and see what's going on. My HCG was like still 10,000 plus, which right away she was like, okay, let's get in the ultrasound room. Let's see what's going on. It really looked at the time like it was a molar pregnancy because there was still like an insane amount of tissue remaining in my uterine cavity. So went back to my OB. I had done chromosome testing on the products at conception from the first DNC, but we hadn't gotten those results back yet. And I insisted right away that we go do a second DNC. Between that, before I had the surgery, they said, I went to radiology, had another ultrasound, and they were pretty sure it was a molar pregnancy, which if you don't know what a molar pregnancy is, it's people think of it like cancerous type tissue. It continues to proliferate or continues to develop. And so those HT levels don't go down. It can take 6+ months to resolve, and you have to have your HCG monitored consistently. So, of course, I was freaking out and, went through that second DNC. Luckily, we found out a few days later, the results came back. It was not molar, but it was something called triploidy, which is where the embryo has 3 sets of chromosomes. So it was definitely very abnormal. So at least it gave me a reason for the pregnancy loss. Again, went about my couple of weeks, thought, okay, everything should be resolved. Did another ultrasound, and there was still tissue remaining in my uterus. And in addition to that, during my second DNC, my cervix got torn during the procedure. And so of course that added this additional layer of stress, like, great, when I get pregnant again, like, is this going to be an issue? Am I going to have an incompetent cervix? Like, all the things that go through your mind, you start spiraling then, okay, how am I going to get pregnant again? And then when I do, like, ignorance is bliss, right? I always kind of say ignorance is bliss. And when you've had a miscarriage, you are completely not ignorant anymore. And you start to think about all the things that could go wrong. So ultimately, I'll kind of speed this up a little bit, but ultimately, I had that third surgery, which was a hysteroscopy. So we were actually able to go in with a camera, remove the remaining tissue. And then, a couple of months later, I ultimately ended up doing IVF. It took a long time to get pregnant, even with IVF. I had a couple of failed embryo transfers. Of course, was wondering if there was now something wrong with my uterus after the multiple surgeries that had occurred. I was having issues with fluid in my lining, and I was thinking, oh my gosh, this is because they tore my cervix, and now I'm having these issues, and I'm never going to get pregnant, and I'm going to need a gestational carrier, and all the things that were going through my mind. Ultimately, though, I did find success on that third transfer. Of course, it was terrifying for the first, trimester, thinking, okay, are we going to go in again and there's not going to be a heartbeat? But I now have my 9-year-old son, which is hard to believe that he's 9. And then I was lucky to successfully get pregnant again a few years later with one of my other embryos. So that's kind of the story in a nutshell. And I kind of will just preface that also, or not preface, but also add, while I was going through all of this, I was working as a nurse in a fertility clinic. So I literally lived and breathed fertility 24/7. Like that, my life revolved around it. So it was quite a couple of years.
Now, are you still a fertility nurse now? Or,
Yes, so
yeah.
I'm still a fertility nurse. So I really, when I started working in the field, despite what was going on with me, like I found my passion in nursing. I went into nursing thinking, I want to deliver babies. I want to be a labor and delivery nurse. And it really wasn't for me because I'm all about building relationships. And so ultimately, I just found what I really love doing in the fertility field. So I worked for many years in the clinic before transitioning to be what you would call a fertility coach, although I really don't like that term, and now run my own fertility support practice.
I guess with labor and delivery, I mean, you just kind of are there for the delivery and then they're gone and you never see them again, right? So there really is none of that
Exactly.
relationship
There's
building that you talk about.
Yeah, yeah. I mean, even when I worked in the hospital, like in a general, unit, you would meet patients and they'd be there for like a week. And so you kind of get to know your patients and bond with them. But in labor and delivery, right, it's like they're in there. First of all, they're not interested in you. They're interested in number one, getting through their labor and having their child. And then they're gone a few days later. So there is no chance to really make a connection with those people.
And you went through so much just with that. And that was your first pregnancy, right? The one that you had.
Yes. Yeah.
I mean, did it make it hard to have, I mean, I don't know what kind of relationship you have like with your OB or anything, but did it make it hard to trust them or did you still like,
I did not end up going back to that OBGYN. And I went to, well, at the time, so after when I got pregnant again, I changed practices. And then that practice actually merged with the practice that OB was with. I think I, I was more frustrated, not, she obviously didn't cause the pregnancy loss, but then I had this torn cervix and like I just felt like, okay, I need a clean slate. Like I need to start over. I never saw her during my pregnancy, but she was actually the one that discharged me from the hospital after my son was born. And I remember she was like, oh, yeah, I often wondered what happened. So I felt kind of bad, but, it wasn't her fault. When you go through a pregnancy loss, and especially one that to me felt very traumatic with, taking multiple months to resolve and all those surgeries, I needed like to start over. I needed everything to be completely different from the first time around.
which makes complete sense to me. I changed doctors too after I actually had to because my OB was retiring. So I was kind of forced to, but I think it was actually a really good thing to be in a new environment and a like, new doctors, new everything, you know?
Yeah, yeah, definitely. It changes your mindset. And I think when everything is the same, you kind of start to think, well, if everything's the same now, won't I end up with the same outcome. Even though that's not logical, it's how it feels.
Yeah, and when you're going through infertility, I mean, you're willing to try anything. You know,
Yes.
I will change
Yes.
anything, I will do anything. I just don't want to be like stuck here forever.
Exactly. Yeah.
So before you became a fertility nurse and before you found out you had the PCOS and everything, did you know other people that were going through infertility, or was that kind of your first exposure to it?
Was my first exposure. I honestly, I knew nothing about what it meant to get pregnant, right? You grow up and they always, you learn in school safe sex and all the things that you could accidentally get pregnant and how common it is. And it turns out it's really not that common. So I didn't know anything about pregnancy, the menstrual cycle. I didn't know anything about IVF. I don't even think if you asked me at the time what IVF stood for, I probably wouldn't have even been able to tell you, just because there's such a lack of education out there. It's not talked about. OBs don't talk about it really at all about fertility and trying to get pregnant. And so I didn't know anything. I thought, okay, well, I just have sex, right? And I pee on a stick a few days later, and that's how it works. And then, my eyes were completely opened once I entered the fertility space, and you learn all of the nuances of the menstrual cycle and all the things that have to be right for pregnancy to happen. So, yeah, I mean, no, I did not know anything.
I was the same way. I mean, I was just shocked at how hard it is for so many people to get pregnant. And it's not as easy as they claim it is for everybody. I mean, yeah, some people get lucky and it's super easy, but there's a large population of people that have to go through a lot. And sometimes
Yes.
they still don't have a living baby.
Absolutely. And I would say anybody listening, I mean, I'm sure everyone knows somebody, whether they know it or not, everybody knows somebody who's touched fertility treatments or been diagnosed as, infertile in some way, shape, or form. It's so incredibly common. And I think that's such a, I think it's helpful for people to know who are struggling that they're not alone, but they still feel very alone because nobody talks about it.
Yeah.
Nobody talks about it.
Well, then you just feel like there's something wrong with me, and why can't I do this when it seems to be so easy for everybody else? And then, starts the guilt and the blame and all those fun things that come along with
Yeah.
infertility.
All the things. Yep. Yep.
So I know IVF places and fertility treatment centers, they're all different. I know there are some really good ones, there's some, not as good ones, but kind of touching on like the relationship building that you were talking about. There's a lot of clinics that are kind of impersonal, that are more,
Mm,
it's like they're in the business of getting you pregnant, but then after that, it's like nothing. So what
yeah.
what was kind of your experience with that?
So for me, I think it was different, right? Because I worked in the clinic and so I had access. But I will say that even being in the clinic, this is something I talk about all the time with, individuals that I'm working with is even as a nurse going through treatment, working with patients every day going through fertility treatment, I still felt extremely isolated, which you wouldn't think would be the case when I could turn around at my desk and talk to my colleagues, my other nurses, or I had my doctor who I saw 5 days a week. But I still, I did all the things that I now tell patients not to do. I would go home, I would Google, I would go on Facebook. TikTok wasn't around the time, but I know that's what they do now is they go and they get their information from these online sources. And it's just, clinics are incredibly busy. And it's not for lack of wanting to support patients. One of the things that I realized being on the medical end of it, as well as having experienced it personally, is there's a really difficult access to fertility care for a number of reasons, right? Financial, emotional, where you're located. For instance, if you live out in the middle of nowhere and there's not a clinic near you, or it would take 5 hours to drive, it's going to be difficult to get that treatment. But in addition to that, there are so many patients who actually need fertility treatment and don't ever seek that care. And so I think, clinics are honestly just overwhelmed with the amount of patients that they're trying to treat. And I know the fertility community as a whole and fertility physicians are trying to find solutions to this problem to be able to treat more patients, but it still limits this ability to take them through the process medically, but support the emotional side of it as well. It's really hard to do. And fertility is extremely specialized. And I think, as a nurse, I went into it and I fell in love with it, but that's not always the case. I've met lots of nurses or I've trained nurses who come into the field and it's not really for them. And so either they stay, right, because it's a 9 to 5 job and they can, muddle through, or they ultimately leave. And so you're constantly training new nurses who maybe don't have the experience to be able to, again, support patients or really educate them in the way that I think patients really need to be educated. I could talk about this for
Yeah.
hours. This is like my soapbox.
No, I mean, and it does make a lot of sense, them being overwhelmed and having a lot of patients to see. And like I can understand it on the medical side. But then again, on the patient side, you're like I need that support because like you said, it's so lonely and it's not fun to give yourself injections and do all this for when other people just get to have sex and have a baby. So
Right. Yeah. And I had the medical knowledge. I can't imagine. I try to put myself in patient shoes and understand if I didn't have that medical knowledge, like thinking back to right before I started working in it, I thought you just had sex, peed on a stick, and that was it. Like trying to then understand the nuances of a very nuanced process. I mean, there's still so many things. I should say, one of the things I love about the fertility field is it is evolving every day, and we are learning new technologies and new things every day. And I think that I can't imagine not knowing what was going on with my body, especially patients who have unexplained infertility, right? They don't have a diagnosis. And so they feel even less in control of a process that already feels uncontrollable. And it's because we just haven't, I think we're just scratching the surface with all the things that we can learn in this field. But yeah, it's so isolating and I think that providers don't have the time to spend to really break it all down for patients or sit down with them and teach them how to use a syringe or prepare menopur, right, is like one of the most difficult injections. I don't know how familiar you are with menopur, but it's like you have to mix vials. I mean, that's not a skill that most of us have.
wasn't taught that in high school or college.
No, yeah, exactly.
Yeah,
So
I haven't
yeah.
had to do that one, but I've had to do other like follistim shots and things like that. And I mean, as someone who was terrified of needles, used to pass out like during blood draws, that was me. And then going through infertility, yeah, I learned how to get my blood taken and give myself shots without passing out. So I guess that's kind of a weird bonus.
Kind of a win. Yeah. Well, and then progesterone, I mean, that's like a whole beast in and of itself. And I taught my husband when we were doing it, he's a teacher. So he doesn't know how to do injections. And I like taught him how to do progesterone and I had him practice on like a peach, I think is what I had, or I don't know, something like that, or like a grapefruit. But, these aren't things that as a non-medical professional, like we're supposed to be doing.
Right.
Yeah. Yeah, it really requires some guidance.
It's so strange to look back, like especially since I have living children and I know you said you have living children. It's so strange to look back sometimes on just how much you did and how far like you've gone to get to that point. Do you ever like think about that?
All the time. Yeah. I don't have it up in my office now because we recently moved, but I used to have 3 pictures. So when we finally got pregnant with my son Lucas, I had a picture of him as an embryo that they gave me at the embryo transfer. And then I had a picture of him from an ultrasound and then a picture of him shortly after he was born. And I would keep it up in front of me at my desk to kind of remind me like, look at everything I went through to get to this point. And it's kind of cool. Like I show him and I'm like, that's you. And he's, it's like this little bundle of cells. But no, I think about it all the time and like how much of how lucky I am that it worked ultimately in the end. And I know it doesn't work for everyone, and I've seen it not work for so many people, and it's heartbreaking and it's devastating and lonely and something that you never really get over.
I found that true as well. I still have weird feelings, even though, like I said, I have living children. I still have weird feelings regarding like people's pregnancies and things like it. And I'm like, why am I even feeling like that? But it's like that trauma never leaves you.
No, it doesn't. I mean, I remember when I was in it, and I think this is a common feeling that a lot of patients feel. I would be in like Target and I would see a pregnant person. I was like, I hate you. And like, I have no idea how I have no idea how she got pregnant. Like maybe she did need fertility treatment. So that's the lens I try to view it from now is like anybody who is pregnant. I don't know what their journey was. Maybe their journey was easy. Maybe they were the couple that had sex and peed on a stick a few days later and got pregnant, but maybe they weren't, and maybe it was a struggle.
I think that's a great way to look at it. Because, yeah, I mean, I remember feeling the same way. Like, why is it so easy for you? And then it's like, okay, but you don't actually know that it was easy for them. So I think that's a good
No,
way to, remind yourself that we don't know what people have gone through just by looking at them.
no, yeah, not at all.
So I'm curious, as a nurse, did you learn much about PCOS or like conditions like that while you were in school? Because I feel like every doctor I've ever gone to doesn't know anything about PCOS.
Oh my gosh, you're preaching to the choir. Yes. No, I didn't even know what that term was until I started working in fertility. And it's crazy to me, right? Because there's so many other PCOS is not just related to fertility. It is this lifelong condition that increases our risk for type 2 diabetes. And so we really, if you have PCOS, you really need to be seeing your primary care physician every year and monitoring your blood sugar levels yearly and monitoring things like your hemoglobin A1C. I mean, there's just so many things that come along with PCOS. So it is insane to me that it wasn't something I'd ever heard of prior to getting that diagnosis. And it's insane to me that this isn't something that all providers are talking to patients about. I am actually working with someone right now, and the moment I met her, the moment that we had our first conversation, I was like, has anyone ever said PCOS to you? Because I mean, she fit all the criteria, right? She had really irregular cycles. That was the main thing, but also struggled, right? Women with PCOS can often really struggle with weight gain and things like that. And so when she was telling me her story, I'm like, I don't know. I really think you might have PCOS. She's like, well, I've mentioned this to my OB, and my OB says, no, I don't meet that criteria because she had done the blood work to look at like I'm blanking on it now, but like testosterone and things. So she didn't meet the criteria in that regard. But PCOS is a tricky one to diagnose because it's a diagnosis of exclusion. So you don't have to meet every single criteria to be diagnosed with PCOS. You have to meet two out of the three. And as I've watched her, she started with her OB and now she's kind of with a fertility clinic and everything. I'm like, you have PCOS, but her OB still refuses to like give her that definitive diagnosis. But that's how she's being treated at the fertility clinic. But it's just mind-blowing to me. I find that the OBGYN community especially, and I think, right, they have a lot of things that they're doing with patients. But like that needs to be something that is more forefront or that they're, I don't want to say better educated on. I don't know what the education is of going through medical school, but I just wish it's something that was paid attention to more. I mean, PCOS is one, endometriosis as well, right? Patients go in. I've talked to patients who have been like, I had to go to three OBs to get the diagnosis. And here I am in insane amount of pain every month. And like nobody's diagnosing me with endometriosis.
Yeah, I
It's
had someone I remember on the podcast and she had to go to 9 different doctors. And it was finally, she said it was all the female doctors, especially that kept dismissing her. And it was finally a male doctor who died. And it was like stage 4. I mean, it was,
Gosh.
it was like advanced, but it's just crazy to me that people don't, or that doctors don't listen when we're like, hey, something's wrong, something's not right. Because I feel like we know our bodies better than a doctor would know our body.
Yeah. Yeah, that's what I love my OB for that reason because I go in and I'm like, look, I can tell you exactly what's happening. She's like, I believe you. I'm like, great. That is like that. I mean, I don't know why we wouldn't believe someone when they're saying they're in an immense amount of pain every month. Like that's not normal, right? So
No.
it blows my mind that that gets dismissed.
Well, and especially because they're not conditions that are rare. Like PCOS and
No,
endometriosis are pretty common. So I feel like they should get more attention. It's not like you'll never see a case as an
right?
OB. Like I feel like you'll see one a day, you know?
Right. Yeah, more than likely. Yeah. I mean, there's probably an insane amount of undiagnosed PCOS and endometriosis out there, especially because we're learning things like about silent endometriosis, where maybe you're not presenting with things like pain, but at the surface level, there is some underlying endometriosis going on there, which could be contributing to your fertility. So, yeah, I really hope that as we advance, right? Like further into the future that these things do become more front and center. I know we're talking like during National Infertility Awareness Week. So hopefully, we're doing our job, right, as professionals, or you're doing your job as, creating this podcast and spreading the word that these are conditions that are not uncommon and this isn't a journey that you're alone in. There's so many of us.
Yeah, I mean, when I was going through it, it was several years ago. So I didn't really know about this big community of people and like you said, TikTok wasn't a thing then. And I
Right.
mean, Instagram was, but I wasn't, I just didn't know that there were so many people out there.
Yeah. Social media is great in that regard, right? Because it does, I think, maybe bring some things to the forefront, but there can be also so much misinformation on it. So it's one of those like fine lines where I'm like, okay, I use social media because I hope to be a way to educate others who are experiencing infertility in some way, shape, or form. But it also can be just a host of misinformation. So you got to be
Yeah.
careful when you're out there. And thinking about too, when I went through my own journey, like, yes, I did the thing. I went home and I Googled. I think that's just human tendency but I think that maybe I could view some of what I was reading through a medical lens because I did have that medical background and I had that knowledge. So I might be able to look at something and go, okay, I'm calling BS on that. Whereas somebody who doesn't have that may fall prey and be like, oh my God, like, and go down this rabbit hole unnecessarily.
Yeah,
So
I can definitely see that, especially when you're at that point where you just, I'm like I said, like I will do anything. I'm
anything.
desperate. I'm willing to try anything so I can see, and on social media, people don't always check credentials. Like you obviously have a medical background, but I don't have a medical background and I could just go out there saying whatever I want as fact, but that doesn't make it fact,
Doesn't
you
make it
know?
fact. No. Yeah. And that's the scary thing is anybody can go out there. I see it all the time. I see people on social media like touting things about fertility, and I'm like, no, like this is not true. So we do the best we can to hopefully provide the right education.
And I think too that it's okay to do your research and then maybe talk to your doctor about it and see,
Yeah.
what they have to say about it. I mean, I found that doctors sometimes dismiss things. Acupuncture worked really well for me, and one of my fertility doctors was like, that doesn't work. I'm like, well, okay, I'm gonna keep doing it though. So
But here's the thing about that is acupuncture. I've used acupuncture. I actually didn't use it during my fertility journey, but I did use it when I was experiencing a really bad bout of migraines, and it really helped. And I'm all about doing things. Look, I don't know all the research on acupuncture, but I know that it is relaxing. I know that it has changed journeys for people who have gone through their fertility journeys, and it's not harmful. It's never going to be harmful to do acupuncture ever. And if it helps and it provides some benefit, why would anybody discourage somebody from seeking that out? Like, it's
I
just
don't know.
like your doctor saying that is just not a helpful comment, right?
I know. And she wasn't even like the normal doctor I saw. She just happened to be there that day. And I'm just like, okay, well, I'm glad you're not my doctor, you know?
Yeah, I mean, and acupuncture clinics, it's not just acupuncture. Most of them offer so many other aspects of ways to help people through this process. I know here I'm in the Chicagoland area where we have Pulling Down the Moon. They're amazing. They offer fertility. They offer like fertility support groups. They offer acupuncture, they offer massage. Like they do so many things. It's not just the acupuncture. So, I whether it's actually changing anything, I don't know. I don't have the research on it. I'm not an acupuncturist, but I know that it can provide benefits in a lot of different ways. And so,
Yeah,
I
so don't
think
knock it.
don't knock it. Yeah, don't knock it till you try it. Yeah.
So now while you were going through your infertility journey, did you have to deal with any like people who weren't very understanding or like any of the insensitive comments like that people often say? Did you have to personally deal with any of that?
I I didn't. I'm trying to remember. It's not like I was private about it when I was going through it. I just don't think I really talked about it outside of family. And my family was extremely supportive. I know not everyone's family is, but my family was extremely supportive and it was never put back on me and never, now I think I posted today actually on social media about people saying, "Oh, just relax and you'll get pregnant." Luckily, I never had that. I did when I had my miscarriage. There were some comments that were said to me, more in the realm of like, "Oh, well, this is God's plan," and I know that can be helpful for some, but like for me at the time, I was like, "This is not like no, I don't want to hear that." So no, in general, other than a couple comments like that, I didn't have to deal with it. But I know so many patients and clients that I've worked with who have had those comments said to them or, where they felt alone. My cousin actually, when she went through her journey, I became a source of support for her, and her own sister like started to distance herself because she couldn't be around her because she was depressed all the time from the treatment that she was going through. And so people started like friends and family started distancing themselves, and it broke my heart. I'm like,
Like they're already down and now you're making it worse by abandoning them, basically.
yeah. I think it is really hard for people who have never been through it to understand. It's such a unique thing to go through. You can't really put it into words, really, what it's like to go through fertility, especially because everybody's journey looks very, very different. But yeah, I've had people's family members like say, you shouldn't do this, or, why are you doing this? Or, just keep trying. I've even had OBs tell patients like, you're 41, like you have plenty of time, like just keep trying. And I'm like, what? Like, no, this is not what we were supposed to be saying.
Oh my gosh, no.
No.
Oh man, I mean, OBs, they're
They're
definitely
one
unique. No, there's some
they're
really good ones.
wonderful. Yes, and there are wonderful, right? Just like any area of healthcare, there's good doctors, there's bad doctors. I think, again, there's like a whole host of things that they're treating. They're, pregnant women and, they're doing HPV screenings and PAPs, like annual exams and like all the things in that women's health area. And so I think that's just not like front and center in their minds for patients, but it really should be. And
Yeah.
I don't know how to change that other than continuing to educate.
Yeah, I mean that's what I can think of too. I think just the more that we talk about it and share our stories and hopefully it'll come out there more. And I think also for people who are comfortable with it, because I know a lot of people aren't, but if your doctor does something that makes you uncomfortable or, says something, I think it's important to speak up and tell
Yeah,
them.
I agree. Yeah. I agree. But it's hard to do. And there are people who have stood up and then they still get dismissed. And so I say go find another
Yeah.
doctor because there are so many good ones out there. But yeah, yeah, it can be really hard to go out and try to advocate for yourself.
Oh, it is. I still struggle with it, but I'm trying to get better.
It's hard.
It really is. And I think sometimes we forget too that, we can change doctors. Like we don't have to stay with that one. I mean,
Right.
and I know in some situations you can't for whatever reason, but I think in most cases you can find
Mhm.
another doctor.
Yeah. Yeah. Absolutely.
I had an MFM I didn't like, and I'm like, it was I was like 5 or 6 months pregnant, I think, at the time, and I was like, wait, I can switch. I don't have to stay here.
Yeah. Yeah.
And I did. But
Good.
it's just
As
weird
you
that
should have.
it didn't occur to me before that moment that, wait, I don't like this doctor. Why am I still here, Because I guess
Yeah. And
since it was the one I was referred to, like I
mm,
had to stay.
yeah, and you don't. And it is so important to have a good relationship with your doctor. And some people, right, there's different preferences. Like some people are like, okay, I want the doctor who maybe doesn't have the warmest bedside manner, but man, they have like good success and they know their stuff. And then there are other people who are like, no, I really need that warm and fuzzy doctor, the doctor who, calls me with every result. And so, you do have a choice as a patient, and there are options out there to go and look for someone else.
I think that's a good point. Reading reviews really helped me.
Yeah, I always tell patients about Fertility IQ. I don't know, it's still around. FertilityIQ.com, you can go and you can look up providers. This is specific for fertility, and it's almost like, I don't buy a product today unless I go on Amazon and look at the reviews and like what are people saying about this product. So I kind of think of it like that. It's a website where people who have experienced treatment with that clinic, that doctor, they can go on and they can leave a review. And what's great is not just I couldn't like not just anyone could go leave a review for a physician. In order to provide a review, you have to provide some proof that you were actually a patient at that clinic, like some sort of bill or something. So it's a really great way to go on and kind of see, okay, what is this physician's bedside manner, or how is the clinic staff? Because it's not just the doctor. It's like, how did you feel about the clinic, or how did you feel about the front desk staff, or how did you feel about the nurses? And so you can really get some good information to help you narrow down where to go. I mean, referrals are great, but referrals, right, in the medical side, it's like, oh, well, I'm good friends with so and so, so I'm going to
Yeah.
refer my patients to them, not necessarily knowing how they treat patients like with a bedside manner, really, is kind of what
Right.
I'm getting at.
I hadn't heard of that site, so that's really, I don't, do you know like how long that's been around?
It's been around for at least the last 7 years, I want to say. FertilityIQ.com. I love it. That's where I go and I tell patients, like, put in your zip code. It's going to pull up all the physicians in your area, and well, at least physicians who are on there, which is a good majority. And yeah, you can look up reviews. And I also like SART.org, SART.org. I mean, it's a little more, it's very medical, but it's where like all of the clinics go to report all of their data on IVF outcomes. And so you can find clinics there and like kind of look through their outcomes and what their outcomes look like and all of the data from past years. So also a great resource.
Are there any other resources that you found helpful while you were going through it or afterwards that you showed to patients or anything?
Yeah, one right now that's actually new. It's called Roon, Roon, and they are basically building a platform of information that is curated by medical professionals. They're brand new. They launched, I think, in 2023, but one of the main conditions that they have up there right now is fertility. They also have PCOS, endometriosis, and the way the platform works is you sign up, it's completely free, and you go to it and you type in a question and it will pull up an answer from, how do I say this? It's a little bit difficult to describe. So it takes videos from providers who have answered questions, and the AI generates an answer from the transcript of those videos, but then it will also pull up videos related to that question. So if somebody went to rune.com and typed in, like, what is IVF, the AI is going to pull together all the information in the database from these transcripts. It's going to give an answer, and then it's going to pull up all of the videos that are relevant to that topic. So that's a really cool resource, I think, for patients nowadays. There's also, I did some videos on there for injection training. So that's on there. So there's all kinds of really cool things. And they're expanding to, tons and tons of conditions. So like pregnancy, trying to think of what the contraception. I mean, just all kinds of general OB. Miscarriage, I don't think it's been launched yet, but soon.
Technology is so cool.
I
It's
know it
it's
is.
coming such a long way from, me just doing Google searches.
No, yeah. Well, and now you've got Google AI as well. But AI isn't always perfect either. That's why I like Rune, and I tell a lot of patients about it because, again, it's pulling from information specifically stated by these medical professionals, and all of those videos get reviewed and vetted before they get posted on the platform. So it's not like they could just say whatever they want, right? And it goes in.
Has to be accurate.
It has to be accurate. Exactly.
Well, good. That's important,
Yes.
as
Yes.
we've talked about.
Yes.
So, do you want to talk a little bit about what you do now as a fertility coach?
Yeah. So again, I'll kind of say I don't love the term fertility coach. And it kind of goes back to what we talked about earlier, which is there's a lot of bad information on the internet. And there's a lot of bad actors out there who will call themselves fertility coaches, and they maybe have no medical background, or they will prey on I will do anything to get pregnant people, and they'll say, oh, well, if you work with me, I'll get you pregnant in 4 months and yada, yada, yada. And, I have this plan and sign up with me. And so I really struggle with the term coach. I also don't necessarily agree that someone can be coached. It's not like a life coach, right? Where I'm going to coach you to like have a better life. I can't coach you to be more fertile. So my business is Navigating Fertility with Laura, and I kind of tagline myself as your pocket fertility nurse. My business is in the business of supporting patients emotionally through their journey and helping to educate them throughout their fertility treatment. And so I've been a fertility coach, we'll say, my air quotes, for the last 6 years. I did that with another company, and now I decided to break off and do it on my own. And so, I work with patients, and we do one-on-one sessions to talk about like their fertility journey, to support them emotionally. We do medication training video calls that's included. And then the biggest, I think, benefit is the one-on-one texting support, which I say is on-demand texting support, because people, again, it's social media is at our fingertips all the time. We can easily like type a question into Google, or we can go to Facebook and we can look up a question that we're having in our journey. You don't know what information you're getting. And so I hope to be basically in someone's pocket at any time where they can pick up their phone and they can say, hey, I'm experiencing this. Can you tell me if this is normal? And they don't have to wait for an answer. They don't have to sift through all the information online. They don't have to, call their clinic at 8 a.m. and wait until 4 p.m. to hopefully get a response. And so my goal is really to decrease that stress and then support the emotional aspect as well. And I had a client message me last week, and she just woke up. She's had multiple miscarriages, and she just woke up and she's like, I'm just in this terrible headspace today. I feel like this is never going to work, and I don't know what to do. And so I kind of gave her some tools to, think about, okay, apply these things to help you get through the day. And then I just tell people, anytime you just need a sounding board, like, I'm here to listen. Let's talk about it. Because sometimes just saying it out loud, or, having somebody listen to you who's been through the process and knows the process, can be really therapeutic. So yeah, all of my services are 100% virtual. So again, I think the best way to describe it for people is like a fertility coach. It's just not the terminology I use. I just use fertility nurse, nurse navigator, fertility doula. People think doula and they think birth, but there's so many different types of doulas out there that support all kinds of different aspects of, parenting. Or there's fertility doulas, there's pregnancy doulas, there's postpartum doulas, there's lactation doulas, there's all the things. So I think that's a really easy term for people to understand exactly what I'm doing. I'm providing that support and education and making people feel empowered during the process.
Now you have me laughing over here about the word coach, though. Like, I'm going to coach your hormones to do what they're supposed to do.
Right. Right. Well, and the thing too is, you know, there are things that people can do, right? There's dietary things, but I don't have the magic answer. And I think that the term coach implies that I'm going to be able to tell you something that you can do, and that's going to be the thing, right? Like somehow I'm withholding this secret. And if you work with me, I'm going to reveal the secret to you that is ultimately going to get pregnant. And I can't make promises to anyone, but what I can promise is that when you're working with me, you're going to feel less stressed and you're going to feel supported and you're going to feel empowered because you now have the education to understand treatment. I think so many patients I've encountered in the last 6 years who are going through IVF, they're going through the motions, right? My doctor told me that I should do this. This is what's going to get me pregnant, but they don't understand why, or they don't understand their individual, hormone levels that are kind of dictating what their IVF protocol is and why their medication dosing is what it is. And so I think that's really important. And I think it's important to be able to go into doctor's appointments and know the right questions to ask. So we do a lot of that too, is I kind of prepare patients, hey, okay, this happened. Here's some questions you can ask your doctor at your next visit. And hopefully that makes the visit more productive.
I like that because I think you're right. I mean, especially when I was going through it, I'm like, I don't know why, he'd be like, "Oh, your estrogen's low, so we're giving you this patch." But they didn't really explain much about it. So I
Yeah.
think it is good to have that service to know to even just know what questions to ask.
Yeah, I will not say the name of the clinic, but there is a clinic that I've had patients that have worked with them going through IVF, and they do not have any touch point really during their IVF treatment with the medical staff. So they get monitored in the morning during their IVF cycle, and then they call a number at the end of the day, and it's a recorded message of what their instructions are and next steps. And I'm like, oh my gosh, that's such like an important time for patients to be able to ask questions. Well, okay, you're telling me these results. What do they mean? I've worked with so many people panicking because they're day 4 of their stem cycle and the only 2 follicles were developing. And I'm like, but that's not everything that was there, right? Like, let's understand exactly what it means to be day 4 of your cycle. Let's understand what it means with your estrogen level. Like, if that's not being explained, right, then patients go down the unnecessary rabbit hole of looking for that information in places that they're not going to get the right answer. And especially my biggest thing that I say to patients is fertility is not a linear journey. It's not linear. Like none of us have the exact same diagnosis, the same clinic, the same doctor, the same medication protocol. There's so many factors that play into IVF, and you're not going to go Google and find your Google twin, right? You can't put in, okay, I'm day 4 of stim and these were my results, and pull up a list of people that had the exact same results. And now, okay, well, let's read what happened to them because then that's what happened to me. Like, no,
Be
right? Like,
nice, but
that would
no.
be wonderful if Google was that crystal ball, but it's not. And then it ultimately leads to this like spiral, or, I'll see patients read something on a Facebook support group, which is wonderful to have community support, but it'll be like, a 42-year-old saying, oh, I had this outcome with IVF. And then you have like a 29-year-old who's reading that and it's a completely different circumstance. And I'm like, okay, these are very different circumstances. What this person's saying online does not even apply to your situation, right? So I hope to kind of, because I know we're all going to Google. I tell people, I'm like, stop Googling. But as we said earlier, it's human nature, right? And it's at our fingertips all the time. So I say, okay, if you read something and you're like, then you start to get in that spiral, then you can just text me and say, hey, Laura, I read this on Google today. Like, I'm really freaking out about this. And then I can say, no, that's like not something you need to worry about. Okay. Or yeah, that's legit. Let's talk about it. And then we can kind of talk through, okay, what it is that they're reading and how that may apply to them and what we can do about it.
I think that's amazing. I love that you offer that and you're not just like, yeah, I mean, that could be a concern with no further explanation, Like,
No, no, I mean, yeah, like I said, I went through treatment as a nurse in the fertility space and I still felt overwhelmed and scared. So there's so many individuals out there that struggle silently who, don't even necessarily have the support of their family and friends and they're just going through it, them and their spouse, or maybe completely alone. I've worked with lots of single women who are, pregnant, trying to get pregnant on their own, which is wonderful, but they don't have necessarily that support base. And I say fertility takes a village. It's not just, you need friends, you need family, you need your clinic, but I can step in and hopefully be that outside resource for you. I mean, even my husband, I love him, but sometimes, like, you don't understand. You're not the one giving yourself the injections every day. It's not happening to your body, right? You didn't have the multiple surgeries to, resolve a miscarriage. And I know, not to dismiss him, I think men are often forgotten in this process. They're watching maybe their spouse struggle, but it can be really helpful just to have someone else on the outside who's lived it, who knows the process, who can then provide that additional support.
yeah, I like that being that outside, like, you don't know them personally, you're just from the outside. I mean, you get to know them, I'm sure, but from the beginning, you can be the
Yeah.
neutral party.
Well, and I always try to get to know people though on that deeper level as well, right? Like tell me, like I've had patients be like, "Oh, I got a dog." And then, like 3 months later I'll be like, "How's your dog?" I want people to feel like a human in this process. I know you can go to your clinic and you can feel so much like, "Oh my God, every time I go in, I'm seeing a new person and they're asking me why I'm here or, they didn't read through my chart, so I'm explaining my whole story again." And I want to make people not feel like a number. I know that's the thing that we hear fertility patients say a lot. Every time I go to the clinic, I feel like a number. You're a human being and let's treat you like a human being, right? And so I really want to get to know people on more than just their fertility journey, but also who they are as a person. And that's only going to ultimately help me support them better as well.
So if people are interested in working with you or finding out more, where would they go for that?
Yeah. So Instagram is a really great place to find me. But I also have a website. So my website is just www.yourpocketfertilitynurse.com. On my website, you can sign up for a free support call. So, before I work with anyone, we have to establish, is this a good fit, right? Am I someone that you feel would be beneficial? So I do free, 30-minute calls with everyone. So you can find that link on my website to book a time. And then my Instagram handle is at Navigating Fertility with Laura. So those would be the two best ways to find me. I'm also on Facebook. I don't know how many people use Facebook anymore as their primary like social media, but same thing, if you type in Navigating Fertility with Laura or Your Pocket Fertility Nurse, you would find my page there as well.
Well, I want to thank you so much for coming on today and sharing your story and all this great information.
Yeah, thank you so much for having me. I really appreciate it. Any chance that I get a opportunity to talk about, what I'm so passionate about, I'm grateful for. So thank you.
Thank you so much, Laura, for sharing your story and all of this great information about fertility care with us. So often, we don't think about how important it is to have the support of our doctors and nurses at the fertility clinics. Not only are we going through an emotionally, financially, and physically hard process, but we're often doing it for the first time. We don't even know what we don't know about the process. We need to be able to ask questions and feel supported. And as Laura said, I know it's hard to find the balance between treating the large number of patients needing testing and treatment while still spending adequate time with everyone. I don't really know what the answer to this is, or how to balance between the two. So hopefully, as everyone continues to share their experiences and their stories, we can move more towards that direction. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please take a moment to leave a positive review or rating on Apple or Spotify. Thank you so much for tuning in, and remember, we are all in this together.